Hello ladies and gentlemen, this is Didem Susken from Metro NCC Psychology and I would like to deliver my final presentation today. But before we start, let us watch a short but striking video about the topic made by 3 Minutes to Save a Life. Today, I would like to talk about the most common eating disorders in young females, and during my presentation, I will follow the outline on the slide. As can be seen, firstly, I will give some background information about the subject and then further explain the most common eating disorders in young females like anorexia nervosa, bulimia nervosa, and binge eating disorder. First and foremost, we should define the eating disorders to have a better understanding of the term. And then we will move forward with the types of the disorder. Sternheim in 2017 defined eating disorder as the severe irregularity or difficulties in eating ability that might be caused by various psychological or sometimes even physiological factors. As suggested by Zam in 2018, although this illness is mainly believed to be a lifestyle choice, it is much more serious than that and oftentimes might lead to fatal consequences. Both above-mentioned groups of authors in their articles divide the eating disorders into several categories such as anorexia nervosa, bulimia, binge eating disorders, night eating syndrome, and eating disorders that are otherwise not specified. At this point, you might rightfully wonder how we can realize or maybe even detect the potential indications of such disorders. The most common signs are excessive exercise, fear of eating, obsession with being fat, low levels of electrolyte, and interestingly enough, unusually large intakes of food. Now, we are going to cover same facts that were stated by Zam in 2018, which were the most prevalent 3 types of eating disorders in young females are anorexia nervosa, bulimia nervosa, and binge eating disorder. The main reason I opted for these disorders in particular is that I wanted to arise awareness in young females like myself, since I have personally gone through it and I was able to overcome it, as well as other members of the society. Because I do believe that this problem is underestimated by societies, hence many young victims cannot receive medical attention from their friends or families, healthcare professionals, and the public. Now, moving on with our first illness, as we learned from Okumush in 2020, anorexia nervosa is closely associated with the denial of normal body weight despite being underweight, intense fear of being fat, excessive dieting along with exercise, and self-induced vomiting. The same author emphasizes that anorexia nervosa, being a complicated psychiatric case, has a rather high mortality rate, hence needs to be treated in a multidisciplinary way. Treatment of it is absolutely a challenging process for both the sufferer and the caregiver. Secondly, the sickness we will talk about is bulimia. Zam in 2018 claims that bulimia nervosa 2 is a fatally dangerous type of eating disorder. Since it is closely associated with anorexia nervosa, the symptoms are similar except for the fact that bulimia nervosa patients are stuck between the cycle of binging and self-induced vomiting. Please find on the slide the cycle of bulimia. Lastly, the disorder we will be talking about is binge eating disorder. As we learned from Dingmans et al. In 2002, binge eating disorder is a relatively new eating disorder when compared to others in literature. As can be seen with the image, the binge eating cycle is like an endless struggle between the urge for excessive eating and the feeling of guilt for doing so. As can be seen by this chart by National Eating Disorders Collaboration, binge eating disorders covers 47% of the eating disorders shown on the slide. Hence, we can easily make the conclusion that this is one of the most common eating disorders in young females, also with the support of the fact that 57% of binge eating disorder victims are female. Nevertheless, in opposite of what is believed, obesity is not a criteria for this type of illness, as a significant portion of the sufferers are recorded not to be overweight. On the slide, please find the references I used for my research if you're interested. And here are my slides continued for ones who want to do further research on their own. So ladies and gentlemen, my dear friends, I have tried to make a brief explanation of a serious illness that is very common among especially the young females like many of us in this classroom. Not only ourselves, but also our younger sisters, maybe even brothers or our beloved friends might suffer from this problem without us noticing that. The more we learn about it, the better we can help the victims. So please, let us develop awareness from this day forward. With that, I conclude my presentation and I'm ready to receive your questions. Thank you for your attention.